So today we're going to, it's going to be a little bit of a, like, I'm going to have some PowerPoint slides and kind of jump around on a couple of things. And I'm actually going to put them all up on Moodle so you can have them. Actually, I might just put, I think I've got 18 chapters worth. I might put them all up. If you ever want to keep, if you want them, you can have them. I haven't used all the slides because they're not all, I haven't customized all of them yet. I got them from the author, and I usually go through and customize them. I haven't customized all of them yet to kind of what I like, but I'm going to go ahead and put all of them up and you can have them. Today, I'm going to jump around a few chapters, and that'll be probably like the first hour or so. And then the second hour or 45 minutes, I'm going to reserve for basically any kind of question about the counseling profession. And so what I've found in the past is it can be helpful to talk about, sometimes people have questions about the licensing process, or people have questions about, what's the difference in an LMFT and LPC, or, I mean, there's I've heard all kinds of questions. And one of the things that we're trying to do as a faculty is also trying to help you guys as early as we can start thinking about next steps. Even though if you're just kind of starting out, it seems like, I don't know if I want to think about next steps yet. Time goes pretty fast and things fly by. So the second 45 minutes to an hour will be kind of like whatever question you have, and I can answer questions about the class as well. So let's jump in. Let me hide a couple of things. I do want to talk about where is my slide? There it is. Okay. I'm going to talk about two areas specifically today, both chapter, I think 15 and 17 or 16, 17, I can't remember. And so it's kind of towards the back of the book. So let me share my screen real quick. I'm going to make this pretty big. And just so you know, if you don't, I mean, you can always take notes if you want. You don't have to scribble furiously to get everything in, because I am going to share this with you guys. So let me get right where I want, because I'm going to jump back and forth. This is what I was saying. I haven't quite customized some of these slides. I usually kind of do them in a certain order. So if you'll bear with me, I'm going to jump around a bit here. But I do want to talk about a couple of like overarching things when it comes to professional counseling. And that's for basically, counselors can be in multiple types of settings. And the more you've read through the text, you'll see I think he does a really good job of saying, hey, here's all the different areas that you can venture into. And so I want to start with this slide in particular, because we need to just realize that no matter what setting we're in, there's certain principles that kind of apply everywhere. And so some of this information you'll get again, like when you get into an ethics class, or when you get more specific into like counseling theories, and then you'll get more specific when you get into techniques. But there's some basic things that I have found that are super important when we think about working with people just in general, that we consistently need to be reminded of too. Even myself, I've worked with people for a while. I still try to remind myself of certain principles that I think are really important, because what ends up happening is if we don't kind of keep those things in the forefront, it really does affect how we can help people and how how effectively we can work with people. So obviously respecting the client. And when we talk about respecting the client, we're talking about not just like this person that's sitting in front of you, but respecting where they've come from, their experiences, their ethnicity, their culture, their sexual orientation. There's multiple areas and facets of that client that you want to be respectful of. And obviously, an environment that fosters progress, which is very important. Helping them define goals to promote growth. I feel like this one in particular You can do it in multiple ways. It really kind of depends on your style of therapy and maybe the model of therapy you use or the theory you prescribe to. But typically, you want to have some kind of a goal or something that they're shooting for or a reason why they're coming to see you. You want to kind of keep that in the forefront. And sometimes that might change a bit as you meet with them. For example, I started a session with a client about 3 weeks ago, a new client about 3 weeks ago, maybe four. And they were coming to me for one thing they kind of talked about. And we talked about the first session. The second session I started to hear more information. And by the third session, it was fairly obvious that actually what was going on was a traumatic experience that had happened, and wasn't like super obvious at the very beginning that that was really what we needed to work on. But as we talked together, I kind of unpacked some of the things that they were talking about, and we discovered that maybe we needed to focus on basically working through the trauma. And so we kind of made a shift and created somewhat new goals for that. So sometimes your goals could shift and change. And there's even been times where a client might reach some goals and they might want to set some new goals and continue to work with you. And that happens too. And so just kind of keeping that in mind. It's not necessarily like where we're totally goal driven and that's it, but that is a large part of the treatment process. Helping clients understand a couple of things that counseling can be educational for them. It's a process that involves learning for them and growth for them. And also, you want to talk about strengths of the client and focus on those strengths, not just weaknesses. I feel like that one is very, very important. And we kind of talked about this earlier, just the person in the context or the environment is important. And then using techniques that are shown to be valid through prior research. Technique wise, if you're at the beginning of your time at Amerton, you're going to learn a lot more about the different techniques and evidence-based types of therapy. If you're towards the end of your time and you're getting close to the pre-practicum and practicum stage, you're starting to really kind of probably hone in on the type of techniques that you like, the things that kind of resonate with you. And so just kind of keeping some of those things in mind are going to be really important. Okay. There's a couple of other places that I wanted to, some of this stuff is pretty simple. There's a little bit of history here that I'm not going to jump into. I do want to talk about this because there's actually several times in the past few years I've been asked, like, what all can like a clinical mental health counselor do. Some of the most common roles, and it depends on where you kind of see yourself, but like a case manager, you can be an intake specialist, obviously counseling consultant. You can, depending on your experience. I've done some consulting work with different agencies and different like churches. Crisis care is a part of the field that is really starting to emerge as a real niche, and I feel we're kind of in need of more folks that are really good at crisis management and responding to crisis care, and not just in terms of suicidal thought or suicidal ideation. It could be other types of crisis that in responding to those. Obviously, you can be a supervisor. You can be any type of setting in terms of like hospital settings or addiction or treatment facilities, mental health facilities, obviously private practice. If you're going the school counseling route, you could you could be a school counselor and an LPC or LMFT together. You can do those both together. There's medical marriage and family therapy routes that people take now. So there's just a wide variety of things that you can do. The field is kind of, I think, really opened up, and probably in the next 10 years to 20 years, we're going to see even more need for mental health practitioners. There's already a really large need for us right now, not just in Texas, but across the country. I do want to talk about, kind of talked about that one. I don't think there's a lot left on here. I just wanted to hit a couple of these really quickly. I do want to, let me stop here for a second and talk about, in terms of like the DSM-5, which is the Diagnostical Statistical Manual, which when you go through this program, you have a choice to take either one or both advanced psychopathology classes with Dr. Armstrong, and he talks specifically about the DSM and diagnosis inside the DSM. It is really important for us to be mindful of that. And I bring this up because the manual, I think they're on to a revised version of this that will probably come out. They typically look at the DSM periodically and make some changes and some tweaks to some diagnoses, add some, change some of them. So it's really important for us to kind of be aware of that. The one thing that I think the DSM is trying to do a better job of, and that they've been doing a better at, is thinking about cultural formation and doing this cultural formation interview, looking at cross-cultural symptoms, which is really important. And we're going to talk about that here in a second, but it's very important that we are mindful of, especially in diagnoses, we're mindful of cultural considerations. And so, and Dr. Armstrong does a really good job of thinking about that when we think about diagnosis. And the diagnosis piece is important. For example, if you were going to work in the insurance world, let's say, where you take insurance, you have to have, someone would need to have a proper diagnosis to be treated the right way. And that's the way insurance companies typically kind of function, much like a doctor, a medical doctor would. The same. There are, I'm not going to camp out on the ethics piece, because you're going to take a couple of different ethics classes that will really dive into several different areas of ethical issues, complaints, concerns. Typically, when we think about as a whole in the profession, I did kind of want you to see this, because these are actually kind of important to keep in mind. 24% of ethical concerns or complaints against practitioners, especially LPCs, have been regarding inappropriate dual relationships, which is like almost a quarter of the population. That's actually quite a bit. There's some things that kind of should be common sense, but also ethically speaking, like not breaking confidentiality, not having a sexual relationship. You can't have a friendship with your client. There's some guidelines about some of those things. There's just things that you have to keep in mind. And like I said, you'll have a full class or two about these, but I did want to kind of highlight that. I'm trying to okay, I think that was all for this one. I just wanted to highlight a couple of those. I was going through this yesterday and I thought, man, I want to talk about a couple of these things. Okay. Let me jump back in, share my screen again. Okay. I do want to talk today, for the rest of our time, about the idea of knowledge and skills when it comes to multicultural counseling. And again, I'm going to jump around a little bit, and I'm going to hit a couple of different areas inside of this topic. And what I'm going to ask is, if you do have questions, you can ask them for sure. But I'm actually going to stop a little ways in. We're going to have a breakout group too on a couple of different things. And so what I want to talk specifically about is the need for us as professionals in the field to be mindful of, well, the author kind of talks about this changing face of America, which is true. I want us to be really mindful of a couple of things, and this is kind of like overarching principles when it comes to working in a with a multicultural mindset. The first thing is being aware of your culture and your ethnicity, your gender, um, which means being aware of any biases you might have that even might be unconscious to a certain extent, or being aware of um, any triggers for you when it comes to working with different folks. And I don't mean this in a negative. I'm not trying to say that we would use that in a negative way. Just being aware of things for yourself, like having enough self awareness to know kind of where you are when it comes to working with people that are of a different culture, ethnicity, sexual orientation than you are, which is going to happen in the counseling field. That's kind of an overarching one principle. The second thing is realizing that, um, and this is pretty much true for anyone that sits across from you, whether you're working with an individual, uh, a child, an adolescent, an adult, you're working with the marriage, you're working with the family, you're in a group setting. There, you are not the expert in terms of like their life or what's going on in their life or their experiences or their um, whether it's their upbringing or their experiences in their culture, the nuances of their life. You're not an expert in any of those things in their life. And I bring this up specifically because there was a uh, kind of a in modernity there was this standpoint of, there was kind of like an expert that kind of knew everything, and someone would come to them to get knowledge or get help or whatever. With when the postmodern world kind of came into effect, we kind of changed that a bit, where this expert became the person that was more supportive, and not that they weren't an expert in their field, but the person that was coming to them was the expert of their experience or expert of their life. To me, that's really important for a couple of reasons. The first reason is, just like if I was to work with any one of you, um, I might know some information about um, different, you know, areas of, I might know some things about certain ethnicities, like certain principles or certain aspects of that. I might know that there's differences in, for example, there's gender differences in how men and women think on certain things. I know that because you're going to learn those things as you go through the education process. At the same time, I don't know what it's like for someone to be of a different gender than me, or I don't know what it's like for someone to be of different ethnicity than me based on their personal and their actual experience. So I can become super curious about that because I want to learn about it and make that part of the therapeutic process that I work in. So those two things are really important to me. He kind of talks about this in the book a little bit. It's more just kind of general information that he's throwing out, which is fine because you're going to dive into these areas a lot more specifically. Like when you take a multicultural class, um, you're going to be thinking through a lot of these things. And I think it's important to bring up specifically because um, yes, America is changing, but it's not just that it's changing, it's that we need to make sure that we don't forget that we are not experts in everyone's life, and we're not experts in everyone's experience. That sounds like it should be common sense and we should just know that, but unfortunately, um, it's not super common sometimes in the field. It's We still have plenty of folks that kind of think, well, I know how to do counseling, so basically anyone that comes to me, any ethnicity from any culture, I'm going to do it the same way, and that's not really appropriate or helpful, if I'm being honest. And so I've had my own experiences in those areas and done some really horrible job at that, and with some really helpful supervision and some really helpful peers that I've had in my life that have kind of helped me see where I can get better at that. It was super helpful for me. And so that's a lot of information. I know, just kind of throwing it out, but there are a lot of changes that are happening demographics wise in our country that we're going to begin working with different types of folks, which is, I think, is great personally. Um, and so just kind of being aware of your own, if you have your own biases or your own triggers, and being aware that you're not the expert of someone's life. So I hope that makes sense. Do you guys have any question about that? Or before I don't want to jump into anything else, if you have any question about that, or what, anything that you want me to clarify or anything. Okay. All right. So there was a couple of things. Now in the book, and this is what I was talking about earlier, and you're gonna go, this book did a great job of giving you just enough information to kind of understand in general, in terms of uh, different aspects of different ethnic groups in our country. And one of the things that I think is really important, and that I think the book did a good job of, is uh, this second one to me, encouraging clients to speak their own language. Language is not just the words that they're using, but whatever their cultural language is, whatever their ethnic language is, whatever their orientation is, kind of using their own words to describe where they are and their experiences, assessing their cultural identity, which is very important. And I'll just be honest, that's something that I didn't do a great job of when I first started, because I wasn't thinking about it as much. And also probably because I was just trying to learn how to do therapy. And but I've had a lot of really good help with that, when it comes to working with someone in a different culture than myself. Um, uh, and also trying to not just interpret like a client's nonverbals, but like interpret what they're saying and making sure that you understand what they're saying. And I'll give you an example that, this is an example where I did a horrible job that I had to have help with. When I first started, I think probably my second year of when I was getting my license, I was working in a facility that worked with men and women coming out of prison, the federal prison system. And so I worked with several different men and women. Probably 40% of those were Hispanic, or probably more Latino, and then probably 40% African American. And then that's probably kind of the major breakdown. And I was working with a gentleman that grew up in Mexico, came to America when he was 15, let's say, or something, came with his parents. He was a little bit older. And I just skimmed over the fact that he was telling me things that I thought were weird, not realizing that culturally speaking and ethnically speaking, and in his own family, they weren't weird. They were just parts of his world. And luckily I had a colleague that I had been working with and kind of sharing some of these things. And he was like, you're really not hearing him, is kind of what he said. He was really nice about it. He's actually a really good friend of mine. He's like, you're not really hearing him. It's not that you can't speak, like, it's not the English language that you're not hearing. You're not hearing him culturally. You're not hearing the things that he's been through, in terms of like prejudice and looking at being discriminated against and things like that. You're not hearing his story. And that was really eye-opening for me. And I had spent at this point like maybe 6 weeks working with him, and I'm sitting there going, oh my gosh, I'm not listening to, and that really helped me understand that this person I was working with had that experience as well. Which a couple of different things were going on too when I first started there, because I had this kind of mindset about the like a prison mentality, or like people coming out of prison, and my mind was open to a way different world as I worked with those folks. When you're interpreting your clients' words, that's great. We use empathy, we use genuineness, we use warmth, we ask open-ended questions. All that's super important. It's also very important that as we make interpretations, or we try to figure out some of the things that are going on, what things are tied to their cultural experience or their ethnic experience or anything like that we would try to understand. And so the sixth one there, the assess the impact of social-political issues, that's a huge one for sure, and probably will continue to be very big. And there's and again, you guys are going to go into a lot more detail in some other classes. But talking about, and the seventh one is where I was really missing the mark with several of my clients until my friend kind of helped me gently, kind of helped me a lot. Encouraging clients to bring culturally significant, personally relevant items to the forefront. And sometimes they're not even thinking about it. Sometimes they're not even thinking about some of their experiences that are just based on their culture and kind of how things are, how things work inside that culture. So you're going to learn different areas about different cultures, educationally and academically, as you walk through this program, which is very important. You need to know some of those things. At the same time, that's like your book knowledge, and then there's actual application of that, and those need to start kind of blending together. Okay. Let me stop there for a sec. Any question about this at all? I'm just kind of curious. Sometimes I have a lot of questions about what I'm talking about. Sometimes I have none. So I want to make sure that I'm not going too fast. Okay. Let's see. One of the things that happens, let me briefly talk about the religious diversity area, and we're not going to talk about Christianity, but other religions as well. Sometimes depending on where we end up, like if any of you end up in an area where, let's say, the dominant religion is Christianity, versus if some of you end up in a different part of the country or a different part of the world where there's another religious belief that's kind of the dominant religious belief, you'll have some nuances to the folks that you work with based on some of those beliefs. And so keeping in mind someone's not, like their religious belief is also part of their culture. And so keeping in mind that sometimes those, just like you hear clients talk about some of their experiences that aren't your experience, and you might hear clients talk about certain belief or certain values that maybe you don't aspire to, it doesn't mean you can't work with them. It means that they have different views or different values than you do. That's actually really important to remember. And especially when it comes to, like I said, religion is really a pretty big part of people's culture. And kind of going back to what I was talking about earlier in terms of like hearing their language, there's even different types of language that people in certain religious traditions use that you might not know, and you kind of have to ask about just to kind of understand or kind of not necessarily decode what they're saying, but understand what they're saying. And so this is an interesting, if we were going to have a whole discussion on the difference between religion and spirituality, that would be a long discussion, because that's definitely something that's come up to the forefront in the last 20 years. Technically speaking, religion's kind of this organized set of beliefs in a system. It's, attitudes and understanding, really kind of that organizing principle of those beliefs. A lot of times in some type of a system. Spirituality, technically speaking, is a little bit more of like kind of these mindfulness about existential qualities of life. your relationship with yourself and and other people in the world. They obviously can go together for sure, but there's some nuances between those, and sometimes um, those definitions can get flip-flopped for folks. And so those are just some nuanced things to understand. um, I would encourage everyone to, and again, this sometimes it depends on the area of the country or the state that you're in. I have worked, I've actually worked with a large number that would, like, folks that would probably identify as Christian. I worked with a large number of them, but I've also worked with a fairly large number of folks that identify as Hindu. And when I first started working with that group, I didn't know, I knew a little bit about it, but I didn't know enough about it. So I had to kind of do a little bit of study about it, and then ask them about it, because sometimes people think Buddhism and Hinduism are the same. They're different. Those are different types of religions. And so I actually worked with quite a few folks that would call themselves Hindu and were practicing, um, and so kind of learning about that and learning the nuances between those things. And even in terms of, and just like Christianity, this is true. There's different kind of sects or sects or streams of Christianity. This is true for most other religions. There's different streams of those belief systems, and kind of I just started becoming super curious about it, just asking more questions about it, just to understand and allow them to feel comfortable talking about it, which is really important too. Sometimes people, if they're in the minority religious belief system in a overarching society, they might not talk about it that much because they don't want to seem weird, or people don't want to be judged or whatever. So offering them a space to talk about their religious belief can be really helpful to people too. I want to talk. One of my most interesting couples I ever worked with for about 8 months or 9 months. He was Jewish, practicing Jewish, and came from a extremely cool heritage of Judaism from his family, like multi-generation, and a practicing Christian. She actually was raised Catholic and then went more Protestant as she got older, and they got married. Now, they were a little older when they got married, and when they got married, they decided at the beginning that they would educate their children in both streams. And when their kids got old enough, that became a little bit of a problem. It was really fascinating to work with them, because when they presented to therapy, it was for a couple of different things, and they were really struggling just how to talk to each other, and they were struggling with conflict. But some of it was this underlining different belief systems that they had, and it was very interesting to work with them, because that became, those differences were highlighted. But then we started trying to talk about a little bit of kind of the crossover and the similarities between them in terms of what they believed as a result of their religious beliefs. So that was really fascinating. And I've worked with other clients that have differing views on, like, I've worked with atheists and Christian couple, one of them was more atheistic or agnostic, and one was Christian. I worked with Christian and Muslim couples before. I mean, different, and that's definitely something that you talk about. Sometimes they don't bring it up at the beginning, so that's why you kind of have to ask about those things. And when you start asking about it, then you start hearing some ways in which they oppose each other. And so, anyway, I just wanted to bring that up. That was a super fascinating case to work with. Okay, let me stop here for a second. Take a quick pause. Okay, first of all, any question about anything I'm talking about right now? Any question? Okay. See, now I'm thinking about all these couples I've worked with that have all these different belief systems at work. I could just talk about that forever, but that would get us way off on a rabbit trail. And I could talk about people that have different viewpoints and different belief systems than me that I've worked with. I mean, that's just going to happen. It's just part of the work. What I'd like to do right now is, we've got 1, 2, 3, 4, 5, 6, I think we're at about 10 or 11 folks. We're gonna do a kind of a quick breakout room activity, and it's actually going to be kind of like a little, hopefully, I'm hoping, a little bit fun and a little bit interesting conversation. It's usually better when we have more guys. But we have one guy, Blake, holding it down for us. That's great. It's all right. I do want to talk. I just want to have a really quick discussion on. There's just a couple of questions, and I'll just give them to you. The first question is, if we talk about, and keeping in mind we're talking about mental health, we're talking about working with our clients, okay? What are differences between working with men and working with women? Just in gender, we're just talking about gender, okay? What are the differences, but are there any differences if you were working with men and working with women? That's the first question. The second question is, what would it look like to work with someone of a different gender than you? This is where I wish we had more guys, because it's a little bit better conversation. But so what are the differences in working with men and women? Okay, and this could be things you've read, things you maybe think about, maybe you've had experiences as the client. And then what would it be like working with a gender that's different than yours? Those are the basic two questions. I'm going to give you guys a few minutes to talk about that. And then we'll come back and kind of process that. And then I'm going to go through a few more slides. Let me go ahead and put you guys in groups. All right. There we go. All right, you should be able to click on and join those groups. And I'll give everybody a heads up when we're done.
Getting ahead in my career,
this meeting is being recorded,
or aggressive, that women have more leeway. We're more accepted for a larger variety of characteristics than men, but maybe that's just my experience.
Wow.
Yeah, I see that too, but I also see that occasionally when women, especially in the workplace, have masculine assigned characteristics, that they can also be, kept in a box.
So y'all are talking about it from a standpoint of like masculine and feminine characteristics.
Yeah, that's how we started.
Okay. I would love to hear other people's thoughts or input.
I think first of all, we need to see which men speaking about from traditional way or from our modern world, where men, it's actually many men, no more men. So I don't want to offend any gays and everything, but right now world is changed. So if we're speaking about when begin, we need to see what exactly men we're speaking about, because it's right now it's very different. So sometimes men really go in emotions. I can say to you, it's not only United States. We need to see, for example, cultural way, because I was in Mexico when man is crying and show so much emotions that I not show. So they said that I'm cold blood. So because they actually was show more emotions that I'm woman. So it's what we're speaking about multicultural too, and modern type. It's all you need to see. All when you see clients, you need to understand who is in front of you. So this is because sometimes we see Mexican, for example. I deal with Mexican, I deal with Italian people. They're very emotional. For me, I like emotion going from them. So for me, it's, for example, I have my father is German blood. They said to me that I am niece of Hitler because I'm very cold blood. They thinking so. No, we cannot, for example, characterize right now someone like even men and women. So women right now begin to be more strong. Men right now show more emotions. So it can be different. So dealing with men and women today.
Okay.
So trying to say.
Now I'll kind of take responsibility for turning it into a masculine, feminine topic. And I think that's a perfect example. I think you said you're working with Mexican clients. Rather than looking at somebody from an outside appearance of like, okay, man, woman, getting to know them and be curious about, granted, using a Western values-based definition of masculine and feminine, like how do they engage with femininity, masculinity? You know, there could be women that do have more Western traditional masculine characteristics, but just being curious and, like you said, Olga, trying to take that multicultural approach and not just taking things on face value.
We talked about generational, and I think we did the same thing, talking about breaking it up to male and female, and then discussing, you know, that, and of course, the three of us were women that just happened to hold the belief that women are more emotional typically than men. And I guess that's stereotyping right there. I don't know. But we also talked about in terms of just men we knew, and whether it's like a grandfather, a father, a brother, and just those different generations, and how I see the way they were raised and how they were told to hold emotions in and to act a certain way, as someone brought it up earlier about being placed in a box, versus how it is now, just seeing my dad and then, you know, my brother, and how they're a little more open than what my grandfather was. But that's just an observation that we discussed. And again, every patient client is different, so have to be opening to trying to see how you best can listen or help.
Good. Anybody else? This is a good conversation.
I kind of talked about how there's the stereotype that has been around forever about how men can't cry or show emotion, which in turn leads to higher suicide rate in males than females, because they feel like they can't express their emotions without being labeled as feminine or not manly. But then I feel like as like the new generation is coming up, they're kind of breaking down those stereotypes and breaking down those barriers. And so it's becoming more socially acceptable for men to show emotion, which is really good. I teach first grade, so I try to instill in a lot of my students that it's okay for anyone to cry, regardless of gender. Gender shouldn't have a say in whether somebody can show emotion or not.
Yeah, good. It's interesting. Anybody else? That's good. Good conversation.
Just on the back of what Chloe was saying, I'm a teacher as well. And when I taught middle school, the first time a boy started crying in class, I didn't know how to handle it. I had never seen a man or a boy cry before, a man or a boy, and, you know, in my real life. And so I really did have to look at that. And, you know, I recognized right away I was uncomfortable with it. And how do I handle it? And yeah, so that stereotype certainly does exist. And I think it is good that the younger generation is kind of breaking those walls down, because crying can be a wonderful release. But yeah, I really had to look at that and my own background and how I perceived it.
Yeah, I think you guys are bringing up some really interesting aspects of the conversation. So here's a couple of things to think about. And I'm going to use Audra. I'm just going to use your phrasing because it's a super common phrase. So it's not picking on you per se. It's just a phrase. Women, it's okay for women to show emotion, or it's okay for women to be emotional, which is a pretty common phrase in general. It's really if we're being honest, it's a cognitive distortion, because everyone has emotion. right? We all have emotion, right? So for us to say anybody, any person, any at any age to be, it's okay to, you're just, why are you so emotional? Or why, that's just so narrow-minded, really, if we think about it. Here's what I mean. Like, if we strip down to a developmental level, like in terms of just emotion, every human being has emotion. Now, the difference is typically how they're expressed, or how they're seen as expressed, as maybe something's okay, like Olga saying, okay, I'm seen as cold-blooded. I'm female, but I'm seen as cold-blooded because maybe I express my emotion differently than, let's say, a male from a certain cultural perspective, let's say, for example. Or Christine saying, I've never seen a male cry. That's seems, that's a little bit weird to me. We how we express it, there is differences there, right? There is differences how we allow those emotions to either take over or not, or it be expressed or not. So let me pause for a second. I'm trying not to get on super bad rabbit trails like I usually do. So if you guys are okay, we can talk about this, because I kind of think it's important. So I'm just letting you know I'm totally like rabbit trailing now, off track of what I was going to do. But I think this is a good discussion. The emotion that we all have. And I think the second thing to remember about when we think about emotion is that there's definitely been a change in how emotions can be expressed in men and women as times have changed. That's probably pretty true. Like what Chloe was saying, I think there's a little bit of some walls have been broken down there, I think, that are probably good. That's probably not bad, not a bad thing. The 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 thing that I would like for us to keep as mental health providers, what I would like for us to keep in mind is that expressing emotion is fine. Feeling emotion is fine. What we don't want to get trapped in is allowing emotion to be just kind of saying this phrase, it's so you feel what you feel, is exactly true, because no one has control over their emotions. But what it's morphed into is you feel what you feel, and basically that's okay, and everyone has to be okay with it. And that's not necessarily accurate. Case in point, if I'm working with a couple or a family and someone gets mad, I don't have to be okay with them being mad, because I've got my own emotional response, right? Does that make sense? So saying you have to just be okay with it, it's kind of, again, a little bit of a cognitive distortion to me. You don't have to be okay with it. Now, what does that mean? Like, what do we need to be doing? What I think we need to be thinking about is everyone has emotion. Emotion are data points. They're not directives. Like, they give us information. Something's going on, right? Something happened, or we're responding to something, reacting to something, feeling a certain way. We don't need to let our clients feel it. Let them sit there, and then don't give them any tools to help them. That's not helpful to me. What we need to be doing is proactively helping our clients feel their emotion. It's okay. It's not going to hurt you. Realize that it's data. It's not a directive. And also realize that they can feel a certain thing and still choose something different, or choose a different response. For example, if you work with, like, anger's come up a couple of times. I've seen just as many when we talk about gender, and I'm talking about gender as a universal concept. I've seen just as many female gendered folks get mad as I've seen male. I've seen it looks different sometimes, but I've seen all of it, right? So just anger as a whole is a case in point. It's okay to be mad. It's okay to be angry. There's nothing wrong with it. it's not okay to throw a chair across the room. It's not okay to yell at someone, right? It's not okay to drive your car into them. It's not okay, you know, what we've done a bad job of, I think, in our world, and this is somewhat on us, is we focus too much on the emotion and not the response. The response is more important, right? Does that make sense what I'm saying? We need to focus on the response, because the response is what's really important for us, right? What we don't want to happen in terms of what some really good things that are happening now in our world in terms of emotion, like emotional maturity. So emotional maturity is nothing else, nothing other than being aware of what's going on for you emotionally, having curiosity about it, feeling it, and realizing that it doesn't have to be in charge of you. It doesn't mean that you're cold either. It just means that you're emotionally mature enough to go, hey, something's going on here. I don't think I like it. It doesn't feel good. There's some big reasons why we make certain decisions, we do certain things, we behave a certain way because we don't like how certain things feel. So we try to do anything we can not to feel it, basically, right? And so again, if I take a step back and look at it developmentally from, you know, a kindergarten, first grade, second grader, their ability to feel and express emotion is way different than an 18, 20-year-old, their ability to feel and express emotion, right? It's not the same at all. It's different. What I'm trying to say is, I think we've done a good job of allowing emotions to be okay now. We can have a discussion about it, and it's okay. No matter if it's whatever gender we're talking about, it's okay to talk about it. However, some cultures, it's still not okay necessarily. Some cultures, there's still a very masculine way of handling it and a very feminine way of handling it. If I could, I'm trying not to totally stereotype, but culturally speaking, that hasn't necessarily changed everywhere. America is a little different because we've gotten on this kind of kindness kick that we're on right now, which is not bad, but it hasn't really worked either. And I think it's because what we're missing is not necessarily the expression of emotion. What we're missing is how to help people respond to what they're feeling in a good way, right? Not in a not in a negative way, right? Like, it's not okay again to throw something or yell at someone. That's not what we're talking about. But it's okay to feel that, but we need to be teaching them how to respond as a result. Does that make sense what I'm saying? Hopefully. Any questions or thoughts about that? Or
Um, Again, this is from a public education standpoint, but I think we're doing better in schools with that because we've embraced social emotional learning and we're teaching kids that more. And so hopefully, you know, we see, maybe it'll take a while, but a change in how society does express their emotions as we're teaching it more in school.
yeah, I agree with you. And I'm a huge fan of social emotional learning. I think it's very important. What I'm not a fan of is that it does also tend sometimes to put everyone in a box. Like, it puts emotions in boxes and everyone experiences them differently and everyone expresses them differently. And I am not saying that any teacher or counselor or principal or administrator is trying to do something bad or do something, you know, on purpose to be harmful. I'm not saying that. Social emotional learning is not, it's very fascinating that it's happening in schools and not necessarily in every other aspect of society. In other words, for that to happen in school is great. I think it's super awesome. But if it's not happening in other parts of their world, it's almost counterproductive at times. That's what's hard about it to me. That's why I'm talking about, from our perspective as mental health providers, we are going to come across plenty of people now in the generation, in the decades to come, that, Christine, to your point, that have gone through social emotional learning in schools, different programs, different techniques, different interventions. We're going to come across a lot of them that are still going to be missing. There's always going to be something missing from not the fact that they can't express their emotion. That's probably what's changed the most, I would say, being able to express it. But what I don't want us to do is, okay, let's feel it and express it. That's awesome. But now what? We need to help them with the now what. Like, it's okay, but what do we do after? And to me, that's where we can come in and really come alongside. Because sometimes we learn more after it's already happened. And I'll give you an example of what I'm talking about. So, and I've seen this in countless teenagers in the last 25 years. Whatever issue that mom and dad think that they have, they bring them to counseling. So I work with them, and as I work with them, I 85% of the time figure out, okay, something's also going on at home that we need to address. So we bring mom and dad in and we talk about it that way. The other 15% could be totally just school related, peer related. You know, I'm a teenager and I'm having trouble related. It's kind of a breakdown like that. What I've found is that as time has gone, more and more of them are able to say, here's how I'm feeling, you know, identify the emotion, identify like the trigger or something that happened, or identify like when these things happen, I feel this way and then I do this. More and more of them are able to do that. That's actually really good. What I'm trying to say is that's only, to me, like 75% of what needs to happen. The other 25% needs to be the now what, right? I feel depressed, which means I'm sad, or I feel alone, which means I feel lonely, which means when I feel that way, I do these things, right? I'm so glad you're identifying that. Are you actually alone, or do you feel alone? What's the difference? When you feel this way and you tell someone and they don't listen to you, that's really hard. That's very difficult. That emotion that you're feeling, is it there all the time? Is it 100% of the time? No, it lasts about 5 minutes, or lasts about 30 minutes, or it happens every other day. So it's the now what, and sometimes it depends on the client. It's the now what, to me, that we need to be helping people with. Not just identify the emotion, which we're doing a good job of, knowing that we can make, different choices, which we're still doing a good job of, but we need to help people realize that just because they feel a certain way doesn't mean, XYZ thing is going on. We need to help them with, what do we do now? And how can we learn from how we're feeling? What can we do to move forward? And again, the now what in the past has always been get harder, shove the emotion down, shove it down, don't use it. I don't want us to fling ourselves all the way over to just feel everything you want all the time and it's okay all the time. We don't want to do that either, right? So we want to find a middle ground. And I think that's where we're having a little bit of struggle right now. And I'm not talking about this just in schools either. I'm saying just from people that I work with. There's our emotions, our cognitions, and our behaviors all work together all the time. That's basic brain science. That's how our brains work, right? So let's help them all work together. For some people, when they have those emotional, those times where emotions are super high, a behavior is really good for them. Go take a walk. That's awesome. That's really good for them. Or go, my son's got this sounds really crazy, so not every parent do this, but my son, he's got a machete that he's got a big log in the backyard, and he goes and hits it. And, and I'm like, just please, God, please don't cut your finger off. But that's for him, that kind of activity is good for him. My daughter, it's more like she needs to talk and just talk, and get verbally, like verbalize everything, get everything out. And those are just different. But on the back end of that, it's the discussion on the back end when the emotion's down a little bit and the cognition's a little bit more in charge, that you can come in and say, oh man, what was going on? What was happening? Well, this was said and this happened. and then I felt this way and I did this thing, you know, and then I felt bad. Well, how do you feel now? Well, I guess I feel better now. Is there anything you need to do to, you know, either apologize to someone, or maybe you just need to, you know, whatever. When we have those conversations with people after they've had the emotional whatever's going on, that's where you can really cement the now what gains. And and again, it just depends on the context that we're talking about. But when I work with couples, then they come in and you can tell when they come in and sit down, they're mad. Like I've had plenty of couples that they're just mad when they walk in, you can tell. And then we de-escalate. And then about 10 minutes after de-escalation, they're talking more. We can then have a conversation about what was going on and how do you feel now? Is there anything you would do different? And that's a really productive conversation with people, because then you're not just like leaving them hanging. You're giving them tools that they can use for themselves. You can do this for yourself. Anytime you've gotten sad, mad, lonely, hurt, we're talking about primary emotions, right? You have a hard primary emotion that comes out and you react to it and respond to it, you know, whether an hour later or a day later, when you look back on it and look at what happened, it's your way of processing that. It's your way of understanding what you could do different next time, or the things that maybe you shouldn't have done, or I mean, but you can't do it at the moment. You got to, you know, you got to give a little space. So anyway, I'm giving you guys basically now I do a whole class on emotional development. This is like 20 minutes of that. So I hope this isn't confusing. I hope it makes sense. If you're watching this on video, it made a lot more sense at the time than when you're watching it back. Any question about that?
I was just going to say, this goes along with kind of our initiative in Austin ISD, is we have this little tagline, regulate, relate, and then reason. And we talk about how the brain, you have to regulate it before it can get to that reasoning part. And so it just goes along perfectly with what you're saying about the now what.
Yeah.
And I've learned a lot about the brain and the emotions just from professional development at school this year, but it's really enhancing what you're saying, and I'm kind of seeing it in a different light.
Well, it's just a matter of, I mean, brain wise, it's not rocket science. Our amygdala is super powerful and connected to super powerful systems in our brain, in our body. And when the amygdala goes off, the amygdala has no context for what's happening. And you need your hippocampus to come back and go, whoa, hang on a second. What's going on? Well, that's different for a 5-year-old than a 25-year-old. You know, I mean, it's way different. It's different saying to a 10-year-old, like talking about that to a 10-year-old than a 30-year-old. Because I'm working with a client right now that literally wants to know more about why her brain's doing certain things, which is fine. But she's like 35 years old. That's great. We can have that discussion. When you're 15 and you tell a 15-year-old, well, your amygdala is just going crazy. And then when you get your hippocampus involved, blah, blah, you know, obviously you're not going to do that. But brain wise, anything you guys want to know neurologically, there is so much information now about neurological development that we know, like actual things that we know now that we didn't know even 10 years ago. There's so much information that we know that you can find it. It's out there everywhere. The school systems are doing a good job, I think, of introducing a lot of that. I really think it needs to come from more than just the school systems personally. It needs to be, well, that's a whole other discussion. It needs to be more universally shared, I think. Anyway, that's all I'll say about that. Anyway, I think the discussion on emotion, I'm glad you guys were talking about this in your group in terms of gender, because it's not an easy discussion, and there's not like a silver bullet answer to this discussion either.
Yeah, I really appreciated hearing you kind of encapsulate the emotional experience, expression, response process. And I did want to circle back to the original question and just ask, I'd be curious what your response would be, zooming out of the emotion specifics, how or would you treat men and women differently?
So one thing that and this is from my own study, because I'm an emotionally focused therapist mainly. So I'd use attachment theory pretty much universally. And an attachment theory, universally speaking, is cross-cultural too, and cross-gender. So in other words, if the person I'm sitting across from feels safe and secure talking to me, then that's like a win for me, right? So that's automatically, no matter their gender, no matter their sexual orientation, no matter their ethnicity, if they feel safe. So I work really hard on the front end to help that happen, knowing that I'm a white man, I'm a white middle-aged man. And that's a certain message to certain people sitting across from me. Bad or good, bad or indifferent, doesn't matter. I know that. So I have to work really hard to fight through any stereotype that might bring by being as safe and secure and open and welcoming as I can, and non-judgmental especially. Because I'm just being super honest with you guys. There's not all for everybody that we're talking about that we'll work with. Most of the time, people that we work with have come from such judgmental areas of their life. Having someone be non-judgmental of them is like an eye-opening and a cathartic experience for them. So I work really hard to do that. Does that make sense? That's like the first thing. Then there's going to be specific things like, Blake, if I'm working with you, obviously I'm going to, and keep in mind, guys, we all have stereotypes. Everybody has them in our brains. We create stereotypes because we're trying to organize meaning in our brains, right? So I might have a stereotype working with you, Blake, to start out with, just even subconsciously. But I need to know that and kind of try to figure out if that's right or not, right? Like I need to know, hey, this guy comes across XYZ way. He must be this way. Well, maybe that's not true. So I have to challenge my own biases and my own stereotyping in my head to know that, wait a minute, that's not true. He looks like this, but this is actually what's the truth. Same with Chloe. I might look at Chloe and go, well, I know this, and this. She looks like this. She went to Texas Tech, so she's awesome already. Maybe Chloe's not a great person. I don't know. Or the opposite, right? So you just have to think about you're going to have your own stereotype about people in general. You have to know that, and you have to fight against that sometimes. So the way I do it is just try to be as open and non-judgmental as possible. Like really, really dive into Carl Rogers' theory about just that there's such power and empathy and non-judgmental and genuineness working with people. So that's how I approach it. And then after that, then you can figure out, what's going on and how they need help. And, now I've just been talking about it one-on-one. Now, if you have, a couple in front of you, then you're doing it, times two, or if you have a family, right? And so you just have to kind of think, does that make sense? Hopefully.
Yeah, I think so. I was going to ask, is attachment theory something that would likely be covered in the theories and methods class, or?
My assumption would be you'll hear attachment theory in almost every class.
Okay.
Like in lifespan, we talk about it.
Okay.
I talk about it in all my classes because I'm so biased towards it. But yeah, in your theories class, you'll for sure hear about it. Yeah, like I have a whole shelf, like over half this shelf over here is like all attachment theory kind of. I'm a big nerd, so I'm like one of those, once you find something you like, I just read all I can about it kind of nerd, so. Just because Chloe's from Texas Tech, she automatically gets an A. See, that's an automatic stereotype in my brain. Any other questions?
I have a question, Dr. Bedard. My fear is that I will unintentionally say something that's insulting
Oh yeah.
to a client.
Mhm.
And I can't imagine that if that happens, how on earth do you apologize and get them to trust you if you make that mistake?
You will. You probably will. I have. Yeah. One thing about when you start your associate experience, getting your hours and with your supervision, that's when you really can learn more about things like that. I think we're inevitably going to, like everything I just talked about today, there's a high probability that either someone on this call right now or someone that will watch it will rub them the wrong way. That's probably going to happen at some level, maybe. I'm not meaning to. So that makes me think there's two different things here. One is if we say something to someone that's hurtful on purpose, that's one thing.
Right.
Like it's in our intention. Like we say it, and especially if we say a really stereotypical nasty thing on purpose, that's one thing. But if we do it unintentionally, and that's not our intention, and maybe we weren't thinking about it in a certain way, or maybe we didn't know that it was maybe we didn't know it was demeaning or negative, or maybe we just didn't know. You can always ask. You can always be curious, like, hey, and I've done this in sessions where we have a whole session and I think about it later. I'm like, we were talking about this and I don't know if that either made sense or maybe that wasn't taken the right way or something. I'll ask them the next session and say, I hope that didn't come across this way or whatever, and I've never had a client tell me. They've all been pretty honest about it for the most part. But there's an intentionality there to me, right? There's a difference between us on Facebook zapping back at people versus sitting across from someone face to face, and we're not, I can't imagine us intentionally trying to, go at someone, either their character or their ethnicity, or, you know what I mean? Obviously we want to be mindful of it, but I guess what I'm also trying to say is don't let that paralyze you. We're all going to say things or do something that probably doesn't come across the right way. It's probably going to happen. Does that make sense? There's no perfect way. I think it's going to happen.
Thank you.
I wish there was a perfect way, but that's also how we learn. So yeah, that's a good question. So I want to open it up, and I kind of talked about this at the very beginning. Any questions about the class or about the profession, or any kind of question at all would be fine from here on. And if you need to go do something else, you can jump off or whatever, you can stay. But for the next few minutes, if you guys have any questions about anything, I'm more than happy to stay on and answer any of those or talk about any of those things.
Dr. Bedard, I have a question about your summer class that you're teaching, the lifespan development.
Mm-hmm.
Is that something that you run similar to this class, and that it's flexible, and if we're out of town or out of the country for several weeks, it's not an issue?
Mm-hmm. Yeah, it's the same.
Okay.
I teach all my classes pretty much the same. So this one will be, now in the summer is a little weird anyway because of what you're talking about, because I'm going to be traveling too. And so typically what I've been doing the last year with all my classes is having 3 or 4 like Zoom classes like this, depending on the time frame that we have. In the summer, it's probably going to be 3, but the assignments are a little different, and there's exams in the actually I have 2 exams in the lifespan class. It's actually a ton more information than this class, but the format and the style and everything's the same.
Okay, thank you.
Yep. And it's the same if we did it face to face, it would be the exact same thing. So good question.
Kind of I have a field question. Do you have any advice for someone like the situation I'm in where I want to find a job that's very directly as close, as directly as possible related to psychology and counseling, but I'm not licensed? Do you have any just general advice for, kind of students in that situation?
Yeah, I think I've had students in the past that have worked at agencies before, like all kinds of different, like I had a student one time that she worked in a psychiatrist's office. And I feel like I think she did like administrative work or stuff like that, but she did some other things too. So there's jobs like that. It's hard because you can't get a job where a license is needed. So that makes it difficult. But on the flip side, if you find a job, like as you get towards pre-practicum, like your practicum experience, that's when I would start. Like if this was your last class before pre-practicum, let's say like Olga's, this is her last class before pre-practicum, that's when you would really start looking for, to me, that's when you'd really start looking, because you kind of have that, probably have like, 10 or 12 weeks really to try to find something. That's when you'd really start focusing in on finding something that's going to be like related to, you're going to start getting hours for. The problem with what you're asking is this, it's just hard to get jobs in the field that aren't like administrative and, in nature or something like that. That probably happens more. Like treatment facilities and any kind of clinic, like big facilities that hire, multiple types of folks, like hospitals even, those would probably be directions to go, because those could turn into like a site, like a practicum site.
Right. Okay.
Does
Thank
that
you.
make sense?
Yeah, absolutely.
Yeah. What do you do now, Blake?
I'm writing a severance. So
okay, cool.
from my old job,
good.
trying to transition.
Yeah. Good for you. Yeah. Good. Any other questions? All right. Good deal. So I think you have one assignment due today and then one's due next week, maybe. I think I'm right.
Tuesday. Yeah, that's right.
You'll get by Thursday, you'll know all your grades. I think I've done all 3 assignments. I think I'm just I need to grade the one from today and then Tuesday. So, yeah, so by Thursday, you'll know. And when you get, and for those of you that this is your first semester, I don't know. And if you're watching this in the recording, typically grades come out within, like 2 or 3 business days of the semester ending. So, I think are you getting grades electronically now? Like, are they emailing you? I don't know how you're getting them. They used to mail them. And I feel like we get them electronic. Like, how do you get your grades now? I don't even know.
I'm checking online website.
Check online. Yeah. They've changed it, made some tweaks to it. People ask me and I don't always know. I just know what I turn in. So, what was I going to say about that? Anyway, you'll have your grade by Thursday for the class, and I'm going to I'll put the PowerPoints up for the whole class. I'll just put them up on Moodle if you want them. You can take them or not. And I think that's it. I can't think of anything else. Any other questions before we jump off? All right. Now y'all go do something else. And hopefully if I see any of you this summer, it sounds awesome. All right.
Thank you.
Bye,
Have a
guys.
quick
Thank you.
Bye-bye.
Thank you.
Thank you.
Thank you.